Hello everyone, this is Dr. Shishma Sarala, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss about another topic in the bulky uterus series, which is nothing but bulky uterus in perimenopausal as well as menopausal women. Because we are seeing a lot of cases in people who are older, that is 40 or 42 years of age, and more than that, experience bulky uterus. It's a very common symptom these days. So let us discuss how people develop these kind of symptoms, what are the hormonal changes, what happens inside the body, what are the available treatment options, and what is the best treatment option in treating bulky uterus in perimenopausal or in menopausal women. So let's dive into the topic to know more about it. So what is bulky uterus? So bulky uterus can be defined on the terms where the woman is in a non-pregnant stage. That is, the woman is not pregnant, but yet her uterus is enlarged or has increased in its size. That is the formal definition of bulky uterus. A woman who is in her non-pregnant stage yet has an enlarged uterus with the menstrual irregularities is called as bulky uterus. Then let us know what are the signs and symptoms of bulky uterus. Remember, bulky uterus usually represents or has features of menorrhagia. What is menorrhagia? That is, even if you're bleeding for 5 days, the amount of the flow is increasing, or even if you're bleeding for 10 to 15 days, it can increase. That means the bleeding can prolongedly increase, and then there can be spotting continuously from day 1 till day 5, and from day 5 there can be heavy bleeding, and then up till day 10 there can be bleeding, and after day 10 there can be spotting. So prolonged bleeding or increase in flow, even if it's for a shorter period of time, which has more number of clots and more number of blood releasing, that is called as menorrhagia. If there is period occurring in between two periods, and that is called as metrrhagia. You can see menorrhagia and also metrrhagia and menorrhagia combination in bulky uterus. Apart from that, you might be experiencing pelvic pain or pressure. So what is pelvic pain and pressure? Because the uterus has increased in its size, it can cause a dragging down or bearing down sensation and constant pelvic pain, because uterus is attached by ligaments to the backbone and to the other bones in the pubic area. So what happens is that whenever there is bulky uterus, there is increase in pressure on these ligaments as well as on the attaching bones. So you can experience back pain, you can experience dragging down sensation, bearing down sensation, swelling near the hypogastric region. All of this can be there. Apart from that, you can experience abdominal bloating, back pain, and also dyspareunia, which is painful intercourse. If you're someone who's experiencing bulky uterus along with fibroids, then you can experience this condition where there is constipation also, and also urination also increases. If the fibroid is on the anterior side, then frequency of the urine increases. If the fibroid is on the posterior side, it falls on the rectum and can cause constipation. These are some of the additional features wherein it is complicated with fibroids. Now let us see what is perimenopausal stage. See, perimenopausal stage is a stage where menstrual irregularities start, and the irregularities is not menorrhagia, which is longer flow, but it is like the period days, number of days are slowly getting shorter. The number of days you're bleeding is getting shorter, the amount of flow that you're bleeding is becoming less. All of these changes which are gradually add up to a menopausal stage. So this gradual decrease or gradual irregularities that you face can say 5 years, some people experience it for 5 years, some people experience it for 8 years, some people for a year and a half, some people for 2 years. So that period where there is hormonal fluctuation along with this period irregularities, then that stage is called as perimenopausal stage. See, perimenopausal stage, transition period before the menopause, characterized by fluctuating of hormones, cessation of natural menstrual periods or decrease in gradual cessation of a menstrual period, and it marks the reproductive age is coming slower or it is decreasing, and then she can slowly land up into the menopausal stage. And then what is menopause? Menopause can be defined in a very simpler manner. See, it is cessation of bleeding or cessation of menstruation for 12 consecutive months. If you're not bleeding, then that means you have attained menopause. Menopause is diagnosed after a woman has gone 12 consecutive months without a menstrual period. So that is called as menopause. And then what is the connection between menopause, perimenopause, and this bulky uterus? You have to remember that perimenopausal stage and the menopausal stage do have fluctuations, which is hormonal fluctuation. So what happens, the amount of estrogen is slowly decreased, and so is the progesterone level, and then slowly the uterus from the normal size it goes to a little bit smaller size, and then you stop having your periods, and there is hot flushes, there's acne, there's hair fall because of this fluctuation. This is the normal process, right? Some people experience it, some people do not even have change, they just have cessation of menses, right? So what happens, what is this hormonal fluctuation? that can cause a bulky uterus in some people. We will see that. See, estrogen and progesterone fluctuations are common in perimenopausal and menopausal stage, but these fluctuations can cause increase in the uterus lining, because it can be because of fibroids which are already existing in your 30s or in your 40s, or because of adenomyosis which you're already experiencing. Usually, people who are suffering from fibroids and adenomyosis can land up into bulky uterus in their perimenopausal stage or in their menopausal stage. Apart from that, what happens whenever there is fluctuation, usually the uterus size should start to decrease, but what happens because of the stress level, it acts otherwise and there is increase in this level, or because there is severe stress and the cortisol is increased, which can cause increase of cortisol can cause estrogen production in the belly fat, which can increase to estrogen production in the belly fat can increase, and E1 will increase, which will cause estrogen dominance, and it will cause uterine lining to thicken up because there is no progesterone production more in the perimenopausal or in the menopausal state. So there is thickening. And apart from thickening, what happens whenever there is estrogen without progesterone, the endometrial level will start to grow like it has no opposite force to stop it. Okay, and then this perimenopausal and postmenopausal stage fluctuations will add up to the thickness of the uterus. Apart from that, you have to understand people who are using oral contraceptives from a very early age, like teenage, or people who are using oral contraceptives for a longer period of time can also experience bulky uterus or fibroids or adenomyosis in the later ages, that is in the perimenopausal or in the menopausal stage. Usually fibroids start to decrease in the menopausal stage. So mostly if you're using oral contraceptives for a longer period of time, you will many people can start experiencing fibroids and adenomyosis or endometriosis or these bulky uterus changes in their 35s or 38s. Now we have seen how there is a connection between the perimenopausal stage, the menopausal stage, the hormonal fluctuations, and why even though there is drop in normal E2, why there is increase in the size of the uterus, right? Now we will see what are the best treatment options available. Right now we are coming to the conventional form of treatment, which is allopathic form of treatment. Here we have three kind of options. First one is the hormonal therapy, second one is the non-hormonal therapy, and third one is the surgical option. First one is the hormonal therapy. In the hormonal therapy, what will happen is that usually they will be giving you, if it is a drop in normal E2 and P, that is progesterone, or if there is only a drop in progesterone, or if there is increase in estrogen, whatever differences are happening inside your body, according to that hormonal pills will be prescribed to you. Usually they will prescribe POPs or sometimes COCs, which is combined oral contraceptives, or they can give you a Mirena sometimes if you are in the reproductive age. But since we are discussing only about menopause, usually they will be prescribing you hormonal therapy. So in hormonal therapy, apart from taking these medications, you have to understand that these medications will help you in managing the overflow that is because of the bulky uterus, or because of the fibroid combination with bulky uterus, or because of the adenomyosis with bulky uterus, right? As soon as you stop taking these oral contraceptives, there is return of the condition because the hormonal fluctuations which are there, or because of the excess estrogen dominance which is there, that is not being treated, it is just being managed. So there is repetition or recurrence. Apart from that, you have to understand that hormonal therapies have its own backdrops or we can say side effects. What are those? You can increase weight, you can start having skin which tends to be much oilier, your hair can start falling off, you can become a little bit more darker, and then if you stop in between or stop taking these pills for 5 or 6 days, you just forgot to take, you were on a tour, you can experience what is called as mid-menstrual bleeding. Now coming to the non-hormonal therapies, they will be prescribing you NSAIDs, which are non-steroidal anti-inflammatory drugs for your pain, especially because bulky uterus has pain associated with it, and also if bulky uterus is complicated or caused because of adenomyosis, that can also, the pain scale can drastically increase. So they would be giving you NSAIDs, right? If you're using these NSAIDs directly and without any proton pump inhibitor, it can damage your gastric lining or the gastric mucosa. You can experience gastritis. Apart from that, if you're using NSAIDs for a longer period of time, you can experience kidney symptoms. And if you're using this proton pump inhibitors along with NSAIDs for a longer period of time, your absorption capability of the nutrients can decrease. And also, if you're not responding to any of these hormonal and non-hormonal therapies, they would advise you for a surgical option. So coming to the surgical option, they would advise you for a hysterectomy. So hysterectomy, if you're doing hysterectomy in your 40s, you can experience menopausal stages, that because you're just taking away the uterus, which is representing the symptoms of hormonal imbalance, and you're not doing something for the hormonal imbalance. You're just taking away the symptoms of hormonal imbalance. So it can show anywhere in the body. It depends on each person, right? This is how conventional form of treatment treats you. But as you can see here, it has its own side effects and it has its own backdrop. You can say it has its own backlashes. So we need a medicine which has no side effect, which does not cause any sort of removal in the organs, which does not involve in removal of the organs, which does not cause your gastric lining to be decreased or irritated. So that is nothing but homeopathic form of treatment, where we understand the link. What is the cause of the hormonal imbalance? So is it just the age, or is it something related to the stress, or is it something related to your food pattern, or is it something related to your other hormones which are influencing these hormones to become fluctuated? So we are understanding the link here, and we are going to prescribe a drug or a remedy, as we say, where it is completely custom made for you. It is very individualistic in nature, and you will start experiencing hormonal balance. You will start experiencing menstrual irregularities will come down, menses will be much regular, as it should go on, like it should slowly gradually decrease. The same thing will go on with homeopathic form of treatment. Completely safe, much effective, and if taken timely. And then not only that, because we're understanding the link here, any sort of other associated symptoms with these hormonal fluctuations will also come down. That is your hair fall, your acne skin, or your low energy or low libido level, everything will become normal. Okay, so the condition is relieved, it's cured, and the recurrence rate is much less compared to allopathic form of treatment. Coming to the consultation options here at Fidicus Homeopathy, we have two kinds of consultation options. One is online consultation, the other one is offline consultation. If you're someone who's staying nearby the nearest branch of Fidicus, you can come and contact us in person. If you're staying far away from us, you can contact us online, either through audio consultation option or through the video consultation option. Once you've contacted us and you've taken doctor consultation and investigations are verified, especially to the online clients, medicines will be door delivered to you. If you're staying in India, it can take 3 days, 3 to 4 business days. If you're staying in USA, 3 to 5 business days. Apart from that, across the globe, you can have 4 to 8 business days for our medicines to reach your doorstep. If you're someone who is suffering from bulky uterus or any other female reproductive organ diseases, you can contact Fidicus Homeopathy. This is our number. You can call us, WhatsApp us, or messages on this number. Apart from that, if you want to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. So here we have discussed how homeopathy is much better form of treatment than the conventional form or other forms of treatment, right? And how homeopathy is much effective and also much safer. Right, in homeopathy, why should you choose Fidicus Homeopathy? Because Fidicus Homeopathy stands for highest chance of health. Here we follow 3 clear principles. What are those? First one is high success rate. We are already experiencing high success rate in treating bulky uterus, in treating adenomyosis, endometriosis, fibroids. So the success rate is really good. And apart from that, the treatment here is transparent. There is no gray area between the patient and the doctor. Everything will be clearly explained to you. The prognosis will be explained to you. And the personal care here at Fidicus Homeopathy is top notch. Any sort of queries, any sort of myths that you're having, any sort of doubts that you're experiencing, or any symptomatic doubts that you're having, everything will be cleared out. So if you want to choose cure, if you want to choose health, choose Fidicus Homeopathy. So today we have learned how bulky uterus develops in the perimenopausal women as well as the menopausal women. What are the best treatment options? What are the available treatment options, right? So if you're having any sort of doubts or queries regarding bulky uterus or any disease regarding female reproductive organ diseases, you can go to the comment section and leave your comment. We will be replying it to you. And if more number of patients ask us, we are going to do a video on whatever query they're having. So meet you all in the next topic. Thank you.
Fidicus Homeopathy.